evening. Excuse me. It's a pleasure to be with you all tonight. I'm a geriatric care manager. My background is clinical social work, although geriatric care management often involves nurses, involves therapists. There's a lot of us that become care managers. We come from different backgrounds. A lot of folks call care managers the hub on the wheel. That's one term we hear a lot. It's kind of the center person, and then the professionals and other folks that we refer out are kind of the spokes. Sometimes folks call us the quarterback. We're the person that's kind of pitching the plan, pitching the ball to move it forward. Sometimes folks call us the team leader or the coach. Actually, I call our care management services elder care coaching, because that's really what we do. And we do it in a lot of different forms, but we work very, very frequently with family members, with family caregivers, to coach them, to answer their questions, to give them suggestions, to explain various services. So I really like that term coach. The goal for all of us in care management is really to help folks have quality of life, to be living in a safe environment, and to have the best possible health that folks can. So that's really kind of our focus is that safe plan and the best health they can have. So just a little bit of background about the field of care management. Most of us belong to a national organization, the National Association of Professional Geriatric Care Managers. I have some brochures in the back about that organization, and we truly work with each other throughout the country. We might be in touch with somebody in California because there's a family member out there, got a loved one here, and so we really do use that organization. Most of us have a license. It could be in the variety of areas that I mentioned. And we also have a certification in case management. So again, from typically three different areas. Mine comes from the National Association of Social Workers. So we can provide services along a very wide continuum. We can meet with a family or a client just even one time. Sometimes families come to our office, and that's a place that's private, that's confidential, and they can bring in their list of questions. We might ask some basic foundation information about their loved one or the person that they're taking care of, and then proceed with their questions. Sometimes that's all folks need, and they feel like they've gotten some resource information. We've given them some short lists of options, and then they can kind of take it and run with it. Other times, folks ask us to step in. A lot of times it's in response to a crisis, to a change in health. And we might be involved on a brief basis, maybe for a month or 2 months or 3 months, something like that. All of our services are provided at the request of the decision maker or the client themselves, if they're able to make decisions. So, sometimes we'll just do a brief assessment. We'll, again, answer some questions, but we'll be with the person, the client, which just gives us a lot more information about that individual. So we'll go wherever the person who's requesting our services feels it meets their need at that time, whether our office, whether the home. Sometimes if folks are living in an assisted living, for example, we'll go there. We've even gone to the hospital, sometimes even nursing home. So we really are out and about a lot. We don't spend a lot of time in our office. We're out where folks live. So I'd say most of the calls that we receive are in response to a change, like I said, a crisis. Something happened that's made a big difference in that person's life. They're dealing with a new type of illness, or else an illness that they've had is progressing. So we're often responding to changes. Although more and more we are getting calls from seniors themselves that are independent, that are fairly well, but they want to be planning for themselves, which I just love to get those calls. Excuse me, because they're proactive, they want to do the research themselves, they want to make the decisions, as many of the decisions as they can themselves, and they just want to be planning ahead. So we love that when we get those calls. But unfortunately, they're not as frequent as the other ones, responding to a change. I've even had clients that I've been working with for 5, 6, 7 years. And those folks are, one lady in particular, you know, her family's out of state. So they really wanted a local presence and local advocate. So we provide that service. We have another lady who is in the late stages of Alzheimer's. She's in the highest level of assisted living. And the family wants an ongoing coach because they just feel like they need that support. So we've been kind of walking along that journey with them and, you know, raising questions they don't think to ask, or stopping in, coordinating some of the other team players. So we can really serve folks one time, short-term, long-term, years. So it really is individual, and every person's situation is different. And I always say that it's not a one-size-fits-all kind of situation, that each person is a unique person. And so when we assess that person, we want to get to know not only their medical background and, you know, what they did for a living, but just the essence of them. We want to get to know that too, because that will impact on any resources and plans that we might recommend. So our assessments can be brief. They can be very full and comprehensive. Typically, our briefer assessments involve the medical history, the psychosocial information, family information, how folks manage their activities of daily living, how much assistance they need with some, what other ones can they take care of independently. We also want to assess their cognition, if there's any memory changes, and sometimes we'll also assess their mood, if there's any depression or anxiety going on. That can be kind of a brief, you know, just the person themselves, brief history about their medical issues, hospitalizations, and so forth, and then, you know, kind of moving on to answering questions. Or we can take it a very full, comprehensive assessment where we're also asking questions about the legal documents and the finances and how safe is that person at home, where they're living, if they're living in their home still. Do they take their medication correctly as the doctor prescribes? Are they able to respond to an emergency, say a fire took place in the home? Do they know what to do if that happened? What kind of environment do they live in? You know, so we really get into a lot of these other areas. We also ask about the person's faith background and spiritual background because we find that that's very helpful in our recommendations for services and supports and programs for them. We also have a caregiver assessment, and we truly believe that the caregiver is such an important player in any person's plan of care, because if the caregiver's not doing well, then their loved one isn't doing well. So a lot of our time is focused on propping up and supporting the caregiver or caregivers so that they have breaks when they need them, they get respite, so that they can continue the loving care they're providing for their family member. So the caregiver is a really important piece that we spend a lot of time on. So again, and a fall risk assessment, we also do that. So then we put all that information together and then do some research, write up a very detailed, comprehensive plan of care with concrete recommendations for particular professionals that might help them, whether it's, I mean, the sky is the limit. We keep a lot of resource files in our office and in our heads. They might need an elder law attorney to update their documents or to talk about long-term care planning, and we're going to hear more about that. They might need a financial planner to help them kind of place their assets in the best way possible for long-term care needs. They might need a move manager. They might need someone to help them downsize so that they can move into another situation, whether moving into an apartment from a house. I just visited a lady today who has been living alone in her home for many years, single, no family, no children. She's all by herself. So we kind of walked around her house to get an idea of what she needed to downsize and kind of how much space she's thinking about moving into. So that gave me some very helpful information. So then I might recommend that she brings in a move manager. There are such professionals out there that help people downsize, dispose of items they can't take with them, pack, move, and unpack. They're amazing. They're truly amazing professionals. So that's just an example. Just all the questions that we ask then help us to to find the resources that can assist these folks. So basically we're doing assessments where if the family and decision makers want us to continue, then we'll actually implement the plan, actually make the referrals, get the folks on board, home care agencies, all kinds of therapies, whatever the services that they need. We can also be advocates. We often go to care plan meetings when folks are living in, if they're not in their home, especially if they're in assisted living, or they're in a group home, or skilled nursing. A lot of times we're invited to come in and be an outside objective advocate and come in and ask questions, clarify any information for the family, just to be an objective person on the team. So we do a lot of education. Folks come to our office very frequently and say, I'm so confused. I don't understand the difference between Medicare and Medicaid, and what really is long-term care, and what are the do's and don'ts. And so we spend a lot of time educating folks and just answering their list of questions, because it's so complex. I mean, they call it a maze, and it truly is. It's not set up to be simple at all. So we try and make it manageable and bring it down to an understandable level, and then give them short lists that they can then either take and implement, or if they choose for us to do so, then we can do that. We can also mediate and facilitate meetings. We do this a lot, where these family members have this understanding and this opinion, and these family members think differently. So again, we're an outside objective person. We can sit down at the table with all those family members and validate everybody's concerns and everybody's feelings, and try and bring some cohesion, some conclusion to some really tough decisions. We do that a lot. We help families make some very hard decisions. So we can often be an outsider that can come in and be an objective person. We can also be the bad guy. Sometimes family members just say, I can't do this, I can't do this, I can't move my mother, or I can't, I made promises, and we can focus on health and safety, and so we can say that. We can say, we're really concerned about you living here alone. So we can often bring a different perspective to those difficult conversations. Let's see. We do a lot of communication. We do a lot of facilitating. So again, we might bring in those other professionals, bring them on the team, help the family understand the benefit that their services will provide, and then let them take their time with moving on with those services. What we really focus on doing is stabilizing the present, especially if they've called us in response to a change or a crisis. We want to first stabilize the present and then start planning for future needs. And again, if the family would like us to stay involved, then we do that. We try and immediately get some services in place to make that loved one safe, and then move forward. Like I said, we can be an objective outsider and start the hard conversations, facilitate the hard conversations. And we can provide a full plan of care with recommendations, concrete names, phone numbers. We can give them short lists for whatever folks need. So we can often be, like I said, the quarterback, the team coach. One of my team members was recently just called the water carrier. That was a new one. I hadn't heard that one. But she was being thanked for being the water carrier. And so I appreciated that way to kind of frame our services. So.
Maybe take this 2